Welcome back. Well, from Harvard Eye Associates, we have Dr. John Hovannisian. Great to have you here today.
Great to be back. Nice to see you, Ken.
Yeah, it's great to see you. And we're going to talk about something that I don't know if you've talked about before. I assume maybe you have, but it's probably been a while. It's called pterygium. It's not spelled that way.
Pterygium's a tough one. It's P-T-E-R-Y-G-I-U-M.
It's like you look at it, you think, is that a dinosaur that I don't know
That's
about?
right. It's the same root word as pterodactyl.
Yeah.
Isn't that funny?
It is.
Pterygium is a condition that happens on the surface of the eye, and it's a wing-like growth of tissue that usually happens in the inner corner and grows to cover part of the colored part of the eye, where it's really covering the cornea. And it is a common problem. If you look around, and we have a picture we'll bring up eventually, and if you look around, you'll see a lot of people who have redness of their eyes, and this is an extreme case. And just to orient you to this pterygium, this is the patient's eye, and of course the inner corner toward the nose is on your left as you look at the screen.
All right,
here.
so the nose is over here.
That's right. And so here's the colored part of the eye, and this wing-like growth that you can kind of sense why they call it that grows onto the cornea, and it can affect vision, and it can also cause a lot of irritation. This eye is quite red, and many people who have this condition, their eyes are constantly red. This growth is not cancerous, but it sure is irritating.
How does this happen? What causes this, and what can be done about it?
Most of the time, it's related to the environment we're in.
Okay.
And so sun exposure. Another name for this condition is surfer eye, because so many surfers get it. When you think about it, they're on the water. They're getting a double assault from sunlight direct and sunlight reflecting off the water's surface. And then there's the salt in the water and all the contaminants and the sand that gets mixed in and into their eye. And so it's constantly irritating to the eye to be in the ocean water. And so many people develop this kind of problem. We'll also see it among migrant farm workers. A lot of our gardeners will have this kind of thing because they're outside all day. It's almost ubiquitous here in Southern California. Any place you are closer to the equator, this becomes a more common problem.
So what is the treatment for this?
In the mild form, when it's not so irritating, we sometimes can just use lubricating drops, artificial tears, and that gives adequate comfort. But when it starts to grow, as this one we showed does, where it's starting to affect the seeing part of the eye, we get concerned. Or if it's causing constant irritation, we get concerned. Or if it's a disfiguring appearance, again like the picture, that's also a reason to remove it. Now, in the old days, we didn't like to remove these because the recovery was painful for patients, and they would come back. And so anytime you have a painful surgery, and it was about a 50% chance of coming back, doctors don't want to do that surgery, and patients don't want to have it for good reasons. But nowadays, with the modern techniques that we've been using, the recurrence rate is down to less than 1%, and it's about 2% of patients complain of pain. For most people, it's maybe a little irritating for a day or so, but it's truly not painful. The eye is red for about a month after surgery, but it's gradually getting better. And then once it heals, boy, the vast majority of these, the eye looks normal and feels normal, and we don't see them come back either short-term or long-term.
Is this the growth that was shown? Is it like a calcium? Is it basically an irritant, and your body is trying to protect it, much like the reason an oyster is formed? A pearl is formed in an oyster.
Yeah, that's a great example. So there's not, although calcium can form in different parts of the body when there's irritation, this usually doesn't contain calcium. It's a thickening. I think of it almost like a callus in the skin. If you constantly are, working hard with your hands, the skin becomes thickened and hardened. Well, we don't want that on our eye, but that's exactly what happens here. And but once it happens, it's always there, and it'll cause irritation almost all the time. And so we have to remove it. And the way we've achieved better results with this is just using modern technologies. One of them is we use, instead of stitches that we used in the old surgery to hold things together, people don't like stitches on their eye.
Exactly.
If we can avoid it, we use a type of surgical glue. It's made from proteins from blood. It's a blood protein glue that we use to hold things together. And we also use something called human amniotic membrane, which is the surface membrane of the human placenta. Can you imagine that? The
Yeah.
afterbirth when a baby's
Yeah.
born has medical use. And in fact, for 50 years, we've been using this kind of product in medicine, and in ophthalmology specifically, because, you know, the science behind it is pretty simple. If a developing child in the uterus is injured or has the skin cut or has surgery, which is now done routinely, the skin does not scar when the baby's born. And we think that this non-scarring is the result of the protection that comes from the placenta and the amniotic membranes.
Wow.
And so we've used that ability to prevent scar tissue during healing of wounds. So this type of technology is now being used
fascinating.
yeah, for all kinds of wound healing, for diabetics who have problems with their feet, for people who have problems with their eye where we can't get good healing. And so we place that. It's not painful. The patients aren't even aware it's there, but it works, you know, this incredible mother's milk of healing power that makes the eye comfortable and look and feel good when we're done.
One final question. Unless somebody comes in and gets their eye examined, is this something that you can see in the mirror? You'll start to feel an irritation.
Yeah, you know, that's a great question, because different people have different irritations of their eye for different reasons. If you've got a growth in the inner corner that looks like anything like what I showed, usually milder, chances are it is a pterygium.
Okay.
And when you see it in other people, that's probably what it is. And there's nothing wrong with letting them know, you know, hey, there's a treatment for that now, and it doesn't come back, and the treatment is not painful, and it's something that's typically covered by insurance. And so, you know, we encourage people to see their eye doctor so that they can be evaluated.
Yeah, definitely.
Right.
All right. Great information, and something I don't recall seeing before. And
Glad to share it with you.
What's great is, once again, the advances to take care of the problems.
So
They're
exciting to
absolutely
see it all
wonderful.
happen. Yep.
Yeah. So the key is take care of your eyes, and if you're out and around on the beach and these type of areas, you work in the garden, if anything, at least wear sunglasses will help a little bit, right?
You bet. That's right.
Yeah,
Good
definitely.
wraparound design that
Yeah.
you're willing to wear.
Definitely. Yeah, that's the key. Willing to wear.
Keep them on.
Yeah. All right. Good to see you as always.
Good to see you too.
And Harvard Eye Associates, you know, we've been bringing on a lot of their doctors over there, has a tremendous staff, and it's great to have them really right outside the gate. So for both your vision needs and your hearing needs as well.
That's true.
You guys got a great Harvard. Is it called Harvard Ear?
Well,
Associates?
it's Harvard Eye, and that's right. It's called Harvard Ear now. That's right.
Yeah.
Harvard Hearing is the name of it.
Yeah, and really, they got a wonderful staff over there. Great to see you. Happy holidays.
Good to see you too.
We'll
Ken.
see you next
Happy
year.
holidays to you as well.
All right.
See you then.
We'll be right back.